Hello dancers, I'm Dr. Divya Raghavan and today we're going to talk about the shoulder. So the shoulder is a ball and socket joint. So a ball and a socket, right? And so when you're moving your arm up and down, the ball kind of glides and rolls on the socket. If there is any issue in the shoulder, usually what is seen is that the gliding and rolling mechanism of the shoulder is lost. So when you're raising the arm up, the shoulder, instead of rolling like this, kind of translates upwards and causes impingement or pinching pain in the shoulder. Or if you've had a strain in the shoulder, then the ball is not sitting properly in the socket and kind of moves a little bit more. So you feel clicking and popping and you feel that the shoulder is not in the right position. Some of you might have also had like a shoulder dislocation, which is very painful, where the shoulder goes outside the socket and has to be put in. Or some of you might have had shoulder subluxation, where it goes slightly out of the socket but kind of comes back on its own. I have seen dancers have tendinitis. Rotator cuff tendinitis is very common in the shoulder. Biceps tendinitis is common in the shoulder. Again, the shoulder is a very unstable joint. People can do like crazy things, and dancers tend to have hypermobility because they like stretch their limbs to be able to kind of do all the dance moves, which puts them in a slight disadvantage because sometimes they lack the needed stability. Right? So the three common injuries for the shoulder that I see in dancers is shoulder impingement syndrome. Shoulder impingement syndrome, as I explained, is pinching of the structures on the top of the shoulder. Usually is felt when you do overhead movement. Okay, so you guys can try and do this right now while watching the video. Try to raise your arm all the way up, right? Bring it down, raise it out to the side all the way up, and bring it down and see if you feel any discomfort in the shoulder. You can also compare both sides and see if one side feels more uncomfortable compared to the other side. The second common injury that I see in the shoulder, again, as I said before, is shoulder tendinitis. Tendinitis is usually is caused by overuse or wrong use of a tendon, and it leads to inflammation, swelling, pain, redness in that area. And tendinitis pain is usually felt on the side, on the top, or in front. Sometimes people also have tendinitis in the back of the shoulder. Again, because it's caused by overuse. Dancers who do weight bearing on the arm and do a lot of movements like hip hop dancers where they're spinning around their shoulder, or acrobats and Cirque du Soleil performers where they are kind of hanging off a rope, or they are ballet dancers where they are like holding their partner up above the head, puts a lot of stress on the shoulder. The other common injury I see for the shoulder is a capsular sprain. A capsule is a bunch of ligaments that surround the shoulder and they keep the shoulder in the right position. Sometimes like a deep stretch, right? Like you do a quick movement of the shoulder. Usually happens like when you do movements like this or movements like that. And the capsular sprain usually happens on the front of the shoulder. Again, it can happen on the top. I'm just generalizing it to see what are the common injuries that I see. But not everybody has these injuries. There could be several other injuries that can happen in the shoulder. In terms of symptoms with shoulder, you usually see achiness and pain around the joint. Sometimes it's the arm. Sometimes it can radiate down into the forearm. Now, one quick thing I would like to say here is like shoulder issues usually stay in the arm. If it's going into your forearm or in your hands, then that could mean that probably a nerve is getting impinged. Either the nerve is getting impinged at the neck or the nerve is getting impinged somewhere in the shoulder, elbow, or wrist. Okay, shoulder pathology rarely causes tingling, numbness, and pain going down the elbow. So just keep that in mind. So let's talk about how you can improve the health of the shoulder for people who don't have shoulder pain, and talk about a few things that people who have shoulder pain can do. Again, remember, I'm generalizing the exercises. Might not be advisable for everybody to do this exercise. For people who have capsular sprain, initially you have to like limit movement, not move the shoulder, keep it in a sling or something so it gets better. For people with tendinitis, you can do exercises, strengthening exercises that are below 90 degrees. So if this is 90 degrees, you can do strength exercises here, but strength exercises overhead is not advisable till the biomechanics of the shoulder gets better. So try these exercises. Again, if you have specific questions regarding your shoulder, or these exercises are not helping or causing more pain, and you would like to learn some other customized exercises for you, feel free to contact me. I will share my contact info at the end of the video. All right, so let's start with the exercises. Alrighty, so do you know what this is? This is a lacrosse ball. Yeah, this is a ball that's used when playing lacrosse. I use it for massage. So it's a great massage tool because this ball is more dense than a tennis ball, right? And a tennis ball, when you roll on the wall, it tends to glide, right? But this one doesn't glide; it rolls, right? So it's really good to do any trigger point work for your muscles. So right now we're going to use the ball to help release any tension in these upper back, neck, shoulder muscles. Usually if you have a shoulder injury, what happens is that, especially if it's in the dominant side, then when people are trying to reach for a coffee mug or lift their grocery bags, their shoulder is injured and weak, and so they tend to use their upper back and neck muscles. So even though the shoulder recovers or is still in recovering, well, the problem is mostly in these muscles. So the ball comes to your rescue. You're going to use this ball to kind of help massage these areas which are harder to reach. So you're going to move your hair out of the way first for people with long hair, and then keep this ball right here. Remember, it shouldn't be on your shoulder blade, it shouldn't be on the bone. And then you're going to pull this arm across the body if you can. If the shoulder hurts when you do this, you can just keep it on the side. And then roll the ball on the back, side to side. Not doing it on the spine, not doing it on the shoulder blade, just going side to side, just like that. And I would say, like, do it for the maximum of 30 seconds. Don't overdo it. Sometimes people love it, how it feels, right? And then they're watching a show and they're doing it and they keep on doing it and then end up with bruises, right? You don't want to strain a muscle while trying to help yourself. So you can go side to side with this. You can bring it slightly lower and then go up and down. So I'm just doing like a squat movement, up and down. And then you can also do circle movements. One of the things that I have recently learned, which has helped me a lot, is that you can actually find like a point which is like really painful, and then just maintain pressure on that point while doing arm movements up and down. Right? This is called it's like a modified active release technique where you are releasing the muscle while you're doing active movement like that. And this is really good for people who feel that their shoulder is stiff and they feel that something's pulling them and they don't get full range of motion. You can move into a different spot and do other different kind of movements of the shoulder. So this stretch is known as the sleeper stretch because you're in a sleeping position. So you go ahead and lie down on your side. The shoulder that's stiff or achy, you keep it in front of your body with the elbows at 90 degrees. You take the other hand and use that as a lever to push this arm downwards, and you should feel a pretty intense stretch in your shoulder. This is to stretch the posterior capsule, or as I said, the bunch of ligaments that surround the shoulder, the posterior, the back part of that. And you have to hold the stretch for 30 seconds. After 30 seconds, if you can go a little bit more, go ahead and hold that for 30 seconds. And then go a little bit more and hold that for 30 seconds. Again, this is all within tolerance. If you don't feel good about this stretch, don't do it, or hold it for 10 seconds and then relax. And then come back again, do it for 10 seconds and relax. And you can put a pillow to kind of support your neck so you're not like holding your head up. You can also relax the head. It's okay if it kind of falls down like that, and then stretch your shoulder. Alrighty, so we talked about one soft tissue mobility exercise for the shoulder, which was like rolling with a ball, and we talked about a sleeper stretch for the shoulder. Now the next thing I'm going to talk about are stability exercises. I always like to do this. Follow mobility with stability. If you gain range of motion in any body region by doing stretching, by doing massaging, by doing foam rolling, but don't follow it up with some stability exercise, you will lose that range of motion that you gain, right? If you don't use it, you will lose it. So it's important that you do some stability exercise so that it sticks in your brain. You're causing those neural patterns to form. You're telling your body that, yeah, it's safe to use that range of motion. It's okay, the shoulder can do it. And then you will start using it more during function, and that will just reinforce that strengthening. Now, an important thing for shoulder pain is that the strengthening should happen again from the mid back. A lot of shoulder pain is caused by people who do exercises which are in front of the body, like bench presses or push-ups, right? And kind of disregard the muscles in the back. So even for dancers, sometimes a lot of movements can be with the arm in front of the body, or you're holding your body up with weight on your hands, but not thinking too much about your mid back muscles. Again, dancers, please treat yourself as athletes. Do conditioning work, do strength work. Try to bring equilibrium to your body on the days that you're not dancing, so that when you're on stage, when you're performing, when you're doing those back-to-back long rehearsals, your body is able to support you, right? And you are able to stay efficient and stay on point for all these movements. So the strength exercise I'm going to teach you is called the I's, T's, and Y's, right? Because the exercise looks like the letter I, then the letter T, and the letter Y. The I's are done with the arms like by your side, the T's are done, the arms at 90 degree, and the Y is done with the arm in a Y position. Now this exercise can be done while lying on the floor with a towel roll under your forehead so that you're not turning your head. And the important thing to make sure is that you're not overusing your upper back muscles and using your mid back or scapular retractor muscles. So I hope you enjoyed learning a little bit about the shoulder and how to improve the health of your shoulder joint. Once the shoulder starts feeling better with these simple exercises, you can then move on to doing more like weight-bearing exercises like plank or side plank, or doing exercises like bicep curls. Remember, it always goes from proximal to distal for any body region, especially for the shoulder, where you strengthen your mid-back scapular muscles, then strengthen your shoulder muscles, then come to the elbow, then come to the wrist. So don't be very hasty to start doing biceps and triceps, because that's just easy to do. Instead, try to do like rowing exercise or plank exercise to help improve the scapular and shoulder stability. So if you look at the link below, you will be able to see how to contact me, because we are doing tele-rehab sessions right now for dancers who are not able to get to me and see me in person. It's highly effective. So I would say that, let's jump on a video call, and at least I'll get to see your movements and then give you a customized recovery plan. But feel free to call me or send me an email.